You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
So the relief that surgery offers is through identifying the trigger sites and removing the vessels, releasing the nerve. And with the small branches, we will remove the branch. With the larger branches, I save the nerve. And depending on where the trigger site, the surgery is going to be slightly different. But overwhelming majority of the patients now, I have this surgery under local anesthesia through a small incision, go back to work the same day or the next day, and resume their lives the next day. There are patients that they need a week or so recovery, a social recovery, and some patients need actually 3 weeks of recovery. The relief that we offer is very different from medications. In fact, even those who do not have 100% elimination of migraine headaches and they have 85, 90% relief, they tell me that actually for them, the medications are working a lot faster and the intensity of the headaches are reduced and frequency is not the same, it's a lot less. So we help those patients in every way possible. And the reason that they are so happy actually with the outcome because of those factors, even the headaches do not go away completely. And we have been able to do long-term studies on these patients. And we have demonstrated there's no difference between the first year after the surgery and 5 years after the surgery in terms of the results. And that has been scientifically proven. So because of that, I can claim that it's a long-lasting relief. And again, it's not a suggestion, it's a scientifically proven fact that the surgery provides long-lasting relief. Anybody who is considering surgery and wants to understand more about it, I suggest that they go to my website, a website of many of the individuals that I have trained nationally, internationally, learn a little bit more about what the surgery does. And we have many patients who have volunteered to talk to the patients who are considering this surgery and also look into the number of studies that have been done outside of studies that I have done nationally, internationally. There are now 3 books published about migraine surgery. I published the first one, and now there are 2 other books have been written about surgery. I think the more common statement that some of the patients hear from the neurologist that this is an experimental surgery. Experimental surgery would be a year or 2. We have been doing this for almost 25 years. And I've done thousands of it, and many studies have been done in many centers. And everybody comes to the same conclusion that surgery works, surgery effective, surgery is safe.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.